The question is, why is your sleep not as good as it could be? As I noted in my previous videos, poor sleep leads to a number of physiological, psychological, and neurological problems. I talked about one of the main causes of poor sleep, circadian rhythm disruption. I reviewed the importance of getting bright light in the mornings and avoiding bright light in the evenings, especially blue light. I also reviewed some apps you can use on your phone or devices to help reduce the amount of bright light and blue light that your eyes are exposed to in the evenings. I reviewed how you can use a light box in the morning if you don't have access to sunlight. I also reviewed how taking melatonin may not be the best strategy to help you deal with poor sleep. In this next series of videos, I'm going to review one of the other main causes of poor sleep, what I call physiological activation. I'm going to review what it is, what you should avoid, and what you can do about it. I'm Dr. Chris Friesen from Friesen Performance, where I help you achieve your greatest potential by optimizing your psychology, physiology, and neurology. If you want to take your performance and productivity to the next level, you're going to need to improve your sleep. Besides clinical conditions like sleep apnea or restless leg syndrome, there are three general causes of poor sleep. The first one is circadian rhythm disruption. I've already covered this in previous videos. In this video and in upcoming videos, we're going to cover physiological activation. Finally, we're going to have videos covering cognitive overactivation. Each of these contributes to difficulties with sleeping. So what is physiological activation? This refers to when our brains and bodies are overactivated, especially at a time in the evenings when we want it to calm down. The sympathetic division of our autonomic nervous system, the fight or flight system, the stress system, we need that to calm down in the evenings so we can go to sleep. But we've evolved not to be able to sleep if we're physiologically activated. Think of our tribal ancestors. If there was a growl outside the camp, like a saber-toothed tiger, it would not be adaptive if we could easily fall asleep and not worry about this. We're designed for our physiology to become activated so we can deal with the threat. Of course, we don't have threats like saber-toothed tigers anymore, but we have our own relative threats. We want the stress hormone cortisol to peak in the mornings. Without this, we wouldn't be able to wake up. Cortisol helps release glucose from your liver and your muscles, which are stored in the form of glycogen, so it can be used as energy. But what we want is in the evenings for cortisol to drop. Most people with insomnia have a peak in cortisol before bed or in the middle of the night. In these series of videos, I'm going to review what you should not do that are known to activate your physiology and prevent good sleep. In this video, I'm going to review the most common substances people use to help reduce physiological activation. These are sleep medications and alcohol. In the next series of videos, I'm going to review what you should be doing instead. Let's talk about sleep medication. People often use sleep medication in an attempt to try to counteract physiological activation. But many people tend to forget that the use of sleep medication is only a very short-term solution. The sleep you obtain when you're on sleep medications is not quality sleep. It's more like sedation. There's research showing an association between sleep medication use, cancer, and overall mortality. There's also research linking the use of sleep medication and dementia, especially Alzheimer's disease, later in life. One class of medications that's often used to help treat sleep difficulties are benzodiazepines. These are things like diazepam, clonazepam, and lorazepam. These are also prescribed to treat anxiety and seizures. In one study, when older individuals took benzodiazepines for more than 3 months, these individuals had a 50% more likelihood of developing Alzheimer's disease in the next 6 years. There's another class of medications often used to treat sleep difficulties. These are called anticholinergics. Anticholinergics basically block acetylcholine. Acetylcholine is a neurotransmitter, but it also works in the body as well. Acetylcholine is important for muscle contractions, reducing heart rate, and for attention and memory. It's also important for REM sleep, or rapid eye movement sleep. One thing we know is that Alzheimer's patients tend to have lower levels of acetylcholine in their brains. This is why one of the main classes of medications used to treat Alzheimer's essentially tries to increase the amount of acetylcholine available in their brains. I'm going to avoid naming particular brand names when it comes to anticholinergic medications, but these are popular medications. They're medications that are often over the counter. These include medications for allergies, colds, motion sickness, incontinence, hypertension, and depression. These include medications such as Diphenhydramine, which is used to help treat sleep difficulties, but also allergies. Another medication called Dimenhydrinate, that's often used to treat motion sickness and nausea, has been associated with the development of Alzheimer's disease later in life. Other anticholinergics include Amitriptyline, which is a tricyclic antidepressant, but also muscle relaxants that you can get over the counter, like Methocarbamol. Cyclobenzaprine is another muscle relaxant, but I believe this one requires a prescription. Another popular sleep medication called Zolpidem is technically not an anticholinergic, but has been associated with dementia. There's research showing that the use of Zolpidem reduces neuroplasticity and also reduces your brain's ability to learn. There's a well-known problem with the use of sleep medication. This is a rebound effect. I often see this with patients. They're convinced that they can't sleep without sleep medication. The evidence they use for this is that when they don't use the medication for a night or two, their sleep is really bad. But the problem is they don't realize they're physiologically addicted to the medication. Recall that our brain and body works on a 24-hour clock. So if you take a depressant medication, a sedative, every evening, your body will ramp itself up in preparation for that because it wants to stay in a steady state. So once you remove the drug, your body will be more physiologically activated than normal. Most of us have experienced a similar phenomenon with the use of caffeine in the mornings. When we miss our morning dose, we can feel unbelievably tired, groggy, and irritable. This is not really our normal state. This is a state of withdrawal, because what happens is our body is preparing for the stimulant to come into our bloodstream. So it does this by slowing itself down. But if you don't take the drug, which is caffeine, the body's pushing itself down and keeps going down because it's waiting for the stimulant to come and push itself up. Remember, it's trying to stay in a state of homeostasis or a steady state. This feeling when we're off caffeine for a few days, this is not our normal state. This is withdrawal. We don't really know how we're going to feel until we're off caffeine for about a month. This is the same with sleep medication. You need to be off medication for a number of weeks to know what your real sleep is like. When you stop taking sleep medication, you're going to feel more physiologically activated than normal. You may even feel anxious, and this will prevent you from being able to sleep. Like I said, your body is going to require weeks to reach its normal state again. So sleep medication is not a long-term solution to your sleep difficulties. When you take sleep medication, even though you're sedated, you're not getting good quality sleep. You're not getting good deep sleep that's necessary for your body and your brain to rebuild and recover. Always talk to your doctor, but it's probably not a good idea to use sleep medication for more than a few days in a row. And try not to use it for more than a few days in a month. Like sleep medication, people often use alcohol to help counteract physiological activation in order to help them sleep. Alcohol is an interesting drug. It acts like a stimulant at low doses, but after a few drinks, it becomes a strong sedative, or what we call a central nervous system depressant. Difficulty walking, blurred vision, slurred speech, slowed reaction times, and impaired memory. These can occur after only 1 or 2 drinks in a person who hasn't developed tolerance. Of course, heavy usage can lead to both liver damage and brain damage. The majority of those who are addicted to alcohol go on to develop a vitamin B1 deficiency or thiamine deficiency. This can lead to something called Wernicke-Korsakoff Syndrome. Part of this is Wernicke's encephalopathy. This is a medical emergency and is characterized by mental confusion, like easily getting lost, paralysis of the nerves that control the eyes, and difficulties with muscle coordination. Most of these patients go on to develop something called Korsakoff psychosis. This is a chronic and debilitating disorder. It's characterized by severe learning and memory problems. This includes both retrograde amnesia, which means a hard time remembering information from the past, and anterograde amnesia, which is difficulty remembering new information. These patients present very uniquely. They tend to confabulate or make up information that they can't remember. Of course, what I'm describing here is the extreme use of alcohol. But most of us know that alcohol is not healthy for your brain. Don't buy into the myth that drinking a few glasses of wine is good for you. You're better off eating a couple of grapes. Alcohol is a neurotoxin. Some people are under the false assumption that alcohol helps them sleep. While it's true, alcohol is a sedative. When you drink, you tend to fall asleep faster, but your sleep is fragmented. So you're waking up multiple times a night, and often you're not even aware that you woke up. This is not good quality sleep. It also blocks your brain's ability to go into rapid eye movement sleep, or REM sleep. REM is extremely important for your psychological health. I hope this video helped you see how sleep medication and alcohol are not long-term solutions to your sleep problems. In the next video, I'm going to go over how nicotine, caffeine, THC, and CBD affect your sleep. In upcoming videos, I'm going to go over how other things can affect your physiological activation and interfere with your sleep. After that, I'm going to have a series of videos about what you should be doing instead to reduce your physiological activation. If you like this video, please hit the like button, subscribe to get alerted when new videos come out, share with friends or family or others you think might benefit from the content. Until next time, keep moving forward.